ABC6 investigates. Patients paying the price for medical chopper flights. The sky-high bills charged across the country by air ambulance companies. We're talking tens of thousands of dollars, something many times insurance companies won't cover. Tonight, we're spotlighting the industry, its practices, and those questioning the cost.
911, what's your emergency? 113, ladder 33.
I couldn't do nothing but hit him straight on.
They were on their way to church.
It was a bad wreck, I knew that.
A car crossed right in front of Warren and Ethel Lowe's van.
Several people hurt.
I could feel the glass hitting me.
He's bleeding pretty bad.
Okay.
Dispatch a couple ambulances here.
The driver was uninsured, and the couple was rushed to a nearby hospital. Soon, doctors determined Warren needed to be flown to a larger hospital for treatment, but he didn't know why.
Nothing. Didn't tell me nothing. They just put me in the helicopter and took me.
Warren since made a full recovery, but the most painful part was yet to come.
I showed it to him. I didn't tell him. I just handed it to him. I said, I want you to see this.
I couldn't believe it when I looked at it.
It was the bill for his medical helicopter ride, a balance he couldn't believe.
$47,000, that's ridiculous.
Charged by Air Methods Corporation, a billion-dollar medical chopper company operating in 48 states and flying 100,000 patients a year.
We lose money on 7 out of 10 transports.
Paul Webster is vice president. He says Air Methods is losing money to the uninsured and patients on Medicaid and Medicare. Government programs paying far less than the cost to transport and treat from the air. The company tries to make up that cost on patients with commercial insurance.
It is the way the environment is set up.
That needs to be negotiated.
And the Lowe's aren't alone.
I couldn't believe it.
Frank Slowoski works as a mechanic in an auto shop outside Cleveland.
Cuts and bruises are part of the deal.
He noticed his leg was swelling up and went to a small-town hospital. Fearful it was something terrible, doctors determined he needed to be flown to a main Cleveland hospital. It was 10 miles away, and Frank says it took longer than if he went by ground ambulance.
I could get up and drive myself if I need to. And
after one night in the hospital, Frank was soon back to work. Then the bills started coming.
I'm not disputing that there's a bill. I mean, but come on, 30 grand? I mean, that's nuts.
His insurance denied the claim, saying the air ambulance wasn't medically necessary. Frank was stuck with a $30,000 bill.
They're gouging me, you know. I mean, really, $30,000 for a 10-minute helicopter ride? You know.
How'd you make sense of that?
I still haven't. It doesn't make any sense to me.
No, absolutely not. We're not gouging people.
But we found over the last 5 years, Air Methods' price per mile has doubled, a move Webster calls necessary.
The insurance company that underpays the claim is the one that really sticks them with the bill.
I don't have $30,000.
Frank tried to fight it, but then Air Methods turned more aggressive, demanding payment.
It was just constant. Phone call, phone call. I look, I see the number, I'm like, I know who it is. I don't even want to talk to him.
Now his bill has gone to collections with interest.
I mean, if I had the money, I would just pay anything. I just want it to go away, you know.
Look, if everybody paid their fair share, you know what the charge for this service would be? $12,000. That's the reality that we operate in.
But in Texas, nonprofit medical chopper company CareFlight operates differently.
This is for access on a scene.
CEO Jim Swartz is critical of for-profit companies like Air Methods.
They're not asking for threaten their life savings or anything else. They're not asking for a lawsuit. They're asking you to help save their life.
Swartz says CareFlight looks for the most efficient and inexpensive way to do it. He says for patients like Warren Lowe, his bill would be $11,000 less.
No one should be surprised that a for-profit company acts like a for-profit company.
It just,
for Frank Slowoski,
you know, just, like you said, you know, I'm just Joe Schmo working stiff.
He's left trying to figure out a payment plan and regretting he ever agreed to ride in an air ambulance, something he didn't think he needed and is now paying the painful price.
We found 65% of Air Methods transports are from hospital to hospital, and the CEO makes nearly $5 million. Right now, there is no law in Ohio regulating air ambulance companies. But in Congress, Air Methods says it's pushing for legislation to go after insurance companies and increase payouts from Medicaid and Medicare. I'm Brooks Jarose, ABC6 Investigators.